Good morning, everyone. Thank you for joining us. We're still a few minutes in before 9 a.m., so we're gonna wait a few minutes, allow for folks to sign in before officially kicking off. But of course, our chairs are in the house, as always, ready and eager to connect with each of you. So as a reminder, we do record these meetings. You are currently on mute, but know that there are definitely breaks throughout the agenda where we encourage feedback and strongly encourage you to unmute yourselves and add to the discussion. We want to encourage you also, if you could type in your name, as Tom Cox already did with CVAG. Thank you. Name, agency that you are representing. Thank you.
Could I ask a question? I don't have a chat button, so I don't know if you recognize me as being in there or not. It's Donna Craig from the Desert Health Group.
We got you, Donna.
Oh, okay. It's
not at the top of the.
No, there's share content, the mute, the video, more actions. There's no chat button at all. It's so weird.
Yeah, because you got more actions, then you would have like your face stuff, and then there should be a little like chat thing there. But
This show conversation with a little, would that be it?
Yeah, try that.
Oh, and then it says.
Yeah, show conversation is the chat.
Ah, okay. And I don't know how to type my name in there.
So there's should be a little type a message box at the bottom.
At the bottom, okay. Oh, there we go. Send a quick reply. Would that be it?
Yeah, probably.
Mm-hmm. Sorry, I feel so stupid.
No worries.
We haven't.
These Zooms are gone.
That is not an adjective I would use for you, Donna. So.
Yeah.
Oh, thank you.
And just a little housekeeping. If you're not speaking, go ahead and mute yourself so that we're not getting private conversations recorded or public into the meeting. If you have called in, the mute option is *6 to unmute yourself and *6 to mute yourself back. Make sure to put your name and agency in the chat box to ensure that we record your attendance.
I love that this is such a popular meeting. So already 68 people in attendance. It's 2 minutes after 2.
It's 2 minutes after 10.
I'm 10.
Don't rush today.
I know. My apologies. But welcome everybody. I think Josh, how are you feeling? Are you good? You're ready? You're on mute, sir.
Yes, I'm ready to go, Tanya. Thanks for checking in.
All
All
right.
right.
Sure, we probably have a quorum, so we'll go ahead and get started. Welcome everybody to the May 26th Continuum of Care meeting. First order of business is, Josh, can you call the roll, please?
Absolutely. Let me share our attendance sheet. All right. And I'm just going to go right down the line. So I will just name the agency, and if either the primary or secondary are here, feel free to speak up. So we'll just start. Greg, you're here.
I am.
Anyone from Riverside County Housing Authority? Catholic Charities?
Good morning, Jessica Cortez, Catholic Charities.
Thank you, Jessica. CityNet? Tyler, are you here on behalf of CityNet?
I saw him. There he is.
There we go. Thank you so much. If you see someone pop in the chat, please let me know. I'm working on one screen right now. Karen, you're here. Hi, Karen.
I'm here. Good morning, everybody.
City of Eastvale. City of Hemet. City of Lake Elsinore.
Nicole Daly, I'm here. Our secondary is going to be Alex Teahen, Teahen. And she'll jump on for a little bit for me today.
Right. Just make sure you send a letter to us if it's hasn't been sent already. City of Menifee.
Good morning, Edna LeBron.
Thank you, Edna. City of Moreno Valley. City of Paris.
Josh, Serena's here.
City of Paris, Rebecca Rivera.
Perfect, thank you. And I'm sorry, City of Paris.
Good morning, City of Paris, Rebecca Rivera.
Thank you, Rebecca. City of Riverside.
Good morning, Hafsa.
Hey, Hafsa.
Hey, Josh. I'm here for Michelle and I.
Perfect. CVAG.
Tom Cox here. Good morning.
Thanks, Tom. Coachella Valley Coalition on Youth Homelessness.
Jim Bolos is here. Thanks.
Thank you, Jim. Coachella Valley Rescue Mission.
Kimberly McKinney's here.
Thank you. Community Health Association, Inland Southern Region.
Brianna Eason's here.
Eason, thank you. Department of Public Social Services.
Margaret Atkins is here. Good morning, everybody.
Good morning, Linda Salas is here.
Thank you both. Desert Healthcare District, Donna, I know that you're here.
I'm here. Thank you.
Of course. Family Promise of Riverside.
Hi, good morning, Vicki Bowditch here.
Thanks, Vicki. Habitat for Humanity.
Tammy Marine here.
Hey, Tammy. Jewish Family Services.
Good morning, this is Becky.
Becky. Lighthouse Social Service Centers.
Good morning, Susan Kirshner is here.
Thank you. Lutheran Social Services.
Good morning, Denise Marshall present.
Thanks, Denise. Martha's Village and Kitchen.
Linda Barak.
Thanks, Linda. Mercy House.
Good morning, Dave Jacobs here.
All right. Thanks, Dave. Molina Healthcare.
Good morning, Jackie Portilla here.
Thanks, Jackie. Operation Safe House.
Good morning, Sandra Dunn is here.
Sandra, thank you. Path of Life Ministries.
God's blessings, all. Rusty Bailey here.
Thank you, Rusty. Right back at you. Riverside County Department of Animal Services. Riverside County Office of Education. Riverside County Sheriff Station, HUD Team.
Good morning, Deputy Julian Ramirez and Julia present.
Thank you both. RUHS Behavioral Health.
Good morning, Marcus Cannon.
Thanks, Marcus. Shelter from the Storm.
Good morning, Angelina Co here.
Thank you. Social Work Action Group, SWAG.
Good morning, David and Monica here.
Good morning.
Step Up on Second. Anybody from Step Up on Second? Transgender Health
Josh?
and Wellness. Oh, yes.
This is Emma. I got bumped off. I'm sorry.
Oh, hey, no problem. Nice to see you again or hear you again. Anybody from Transgender Health and Wellness Center?
Kennedy here for Transgender Health and Wellness Center.
Thank you.
And it looks like you have Annie as our secondary, but that should be Tommy Clinton.
Okay.
THOMI, Josh.
THOMI. Thank you. I knew it.
I'll send out the appointment letter to update that for us, please.
Perfect. Thanks, Melanie.
Thank you.
UCR Health.
Catherine Hansen for UCR Health.
Thank you, Catherine. United Way of Inland Valleys.
Good morning, Ken Bell present.
I'm sorry, that's Bell, isn't it? Oh, well, I'm going to fix it. I promise.
Not a problem.
US Vets. Anyone from US Vets? VA Loma Linda. Valley Restart.
Susan Larkin here.
Thanks, Susan. Definitely have quorum. And if I didn't call your name, I went through all of the voting members. If I missed you, please let me know in the chat. And if your name wasn't called, just again, put your name and agency in the chat box as well, and I'll be sure to record it. We do have an ongoing list, so I'll make sure that we get your attendance. Also, it may be worth checking the meeting minutes just to see that we recorded you as well.
Thank you, Joshua. Right. I also want to welcome a new member, the Desert Healthcare District. Donna Craig is the representative. I've been fortunate enough to work with the district for a number of years. So just a reminder, if you're not speaking, if you could mute, because we're getting a little feedback. And Donna, did you want to say anything?
No, just glad to be here, and thank you again for allowing me to allow us to be a voting member. Homelessness has been very dear to the district's heart and resources for a number of years, and I believe we're going to continue with it even when we go into strategic planning in a couple of months. So thank you.
I'll make sure of that. Thank you, Donna. So,
yeah, I know you will.
Additionally, I want to say it's fantastic turnout today, and you know, in addition to like our 45 regular members, we've got looks like about another 30 for like 78 total participants. Just a reminder, if you're not part of the voting membership, as long as you attend 3 consecutive meetings, you are eligible to become a voting member, and you'll just contact the CoC staff to get that going, and the email is coc@rivco.org. All right, item number 2 is approval of the minutes. These were presented in your packet for the April 28th meeting. Any questions or corrections to start? If so, raise your hand or just jump in. I'm not seeing any hands, so I would entertain a motion to adopt the April 28th minutes.
Move to approve.
Thank you,
I
Karen.
second.
And who's the second? I'm sorry, Jim?
Jim Bowles.
Yep, thank you, Jim. All right, any further discussion at all? All right. And since we
Hey,
have
Greg.
yes.
I just want to remind, if you're making the motion or seconding, please make sure to say your name so that it's recorded.
Thank you, Melly. All right, I'm going to call for any opposed. If so, raise your hand. Jessica, in opposition?
Yes.
Okay. And then any abstentions? All right, not seeing any. That motion passes. And I'm going to ask for the membership to indulge me. We have under new business, Tanya, correct me if this has changed since this morning, but the UCR's Homeless Support Specialist Certificate Program presentation, they're under a time constraint, so I'd like to move them up to this portion of the agenda.
That is correct. Thank you, Greg, for accommodating that special request. So today we're going to hear from Annette Webb, who is on the line. Annette, if you're ready, we are ready and eager to hear from you. You can go ahead and unmute yourself.
Great, thank you so much. I do have a brief slide deck. May I share my screen?
Absolutely, we would love that.
Thanks, Matt.
Okay. Thank you so much for allowing me to be present and share some information about the UCR University Extension Homeless Support Specialist Certificate Program, and also for accommodating the scheduling need this morning as well. So I'm really excited to share this with you. My name's Annette Webb. I am the Associate Dean of Academic Affairs for UCR University Extension. Wanted to just share a little bit about us. We are the Continuing Education and Professional Studies Division of UCR. And our vision is really to transform people's lives through the power of lifelong learning. And that happens through a variety of diverse programming, flexible scheduling, and really serving audiences from young children in summer camps through the Osher Lifelong Learning Program geared to retired and mature learners. Our core values behind everything that we offer are really exceptional UC gold standard education, the principle of lifelong learning, applying real world knowledge, diversity, and then flexible and accessible programming. So for the Homeless Support Specialist, this is one of our professional certificates. The idea behind this is that we're empowering everyone in the community. So what people will learn in this program is best practices and how to initially engage with the homeless community, characteristics, demographics, and perceptions of the homeless population, methods for detecting and preventing human trafficking in child and adult populations, techniques for mental health assessment, approaches for treatment, substance abuse content, and then case management methods. When we talked about designing this program, we were thinking about the broad community, you know, not only those who have specific jobs where, you know, they're doing homeless outreach, but also those who encounter the homeless population through their work. So we're talking about nonprofit, of course, but also healthcare organizations, law enforcement, fire department employees, government agencies who have dedicated homeless offices, and then nonprofit board members and others in this area who serve this area. This is what the certificate overview looks like and what the schedule is right now. So there are 6 courses. They're delivered fully online. It's a total of 13 professional credit units, and it can be completed in 9 months. The total cost for the certificate is $2,600, but with early registration, that lowers down to $2,300. And you can see here that the schedule. So in the summer, there are 2 courses. We have these already scheduled starting June 21st and then August 16th. And then in the fall, there are 2 more courses, and in winter, 2 more courses. All of these class sections are open now on our website. So if somebody wanted to enroll in all of the courses, they could do so now and have that plan in their daily calendar. We also have what we call a student success coach model. So if anyone's interested, you could reach out to our student success coaches. They will help you with getting registered, getting your access to the course through our Canvas system, any kind of troubleshooting, additional resources that you might need, any assistance with or questions about the content, specific questions about the content. You can work through a student success coach, and they will be sort of your concierge for your learning experience with UCR Extension. And so that's really the quick overview of the homeless support specialist. And I'd love to take any questions. If you have questions after this, you can reach out directly to me. This is my email address here, but happy to take any questions that anyone has.
Great, thank you, Annette. I know this has been in the works for a number of years, so it's really great to see it come to fruition. So I did have one question. Is there financial assistance available for those who may not be able to afford?
Yes, so there's workforce development funding is available for this. So that's a little bit of a different process than direct enrollment, but it is certainly a path that we could go through. That would be for anyone who's unemployed or underemployed. And that is available, of course, through the Riverside County Workforce Development offices. And then we don't have what you would think of traditional financial aid like matriculated degree earning students would get, but there are some loan possibilities. Those can be found on our website. In addition, if there are groups of employees or personnel who want to take this, we could look at some group discount actions. We're certainly open to discussing that. If we have 5 or more students who are interested in taking, we can do a little bit more of a discount on that.
Great, thank you, Annette. And Hafsa, question?
Yeah, you actually, thank you so much. Greg, you took my question, so I appreciate it. But Annette, I'm Hafsa, and I'm with the City of Riverside. I'm the Officer of Homeless Solutions, and I just want to say thank you again for having these classes. But just kind of taking Greg's question a little bit farther, one of the things in terms of best practices for individuals experiencing homelessness and the greater system of care is also working with individuals who've had lived experience and helping them continue to thrive and become self-sufficient. And so I think that this platform that you're providing is wonderful ancillary to helping us provide individuals who've had lived experience, not only future employment, but then also ancillary to your courses to be able to thrive becoming professionals. And I think that would reflect on our CoC very well if we have some sort of data moving forward in the future that not only have we collectively provided a platform for individuals who have lived experience to do the work, but also ancillary to this course. So something to consider when it comes to fee waiver and et cetera. Thank you so much, Annette.
Yes, thank you. I also wanted to share that regarding the financial component of this, we have worked with school districts, county offices, other nonprofit organizations to provide like closed cohort training where we're leveraging either grant funds or legislative funds that flow for specific training purposes. So we can set up that type of training, closed cohort models, if that's something that's of interest. And Hafsa, I really appreciate what you're saying about the lived experience piece. And I think this is one program that focuses on professionals who work in the space of homelessness. But we do have a large portfolio of professional certificates and other courses that it would be great to see our unemployed or underemployed homeless population as they emerge out of that be able to access workforce funding and take some of these other professional certificates to become employable. So, you know, if we could sort of dovetail those initiatives together, I think that would be a really amazing space for us to work together.
And that Vicky in the chat is asking when the deadline for early registration is.
The early reg deadline is 2 weeks before the start date of the course.
Thank you. Any other questions or comments?
Greg, I see one more question in the chat box. Can the units be applied towards the degree program?
These units are considered professional credit. It depends on the institution where you transfer to. If you're looking to transfer them into a degree or apply them, that would be up to the receiving institution. Normally, they're just considered kind of professional growth, professional development credit, but we do have some articulation agreements. So that is a possibility, but not really broadly applied.
And then we also have a question, would say a group of people from the continuum of care qualify for like a group discount?
I think we could certainly explore that, yes.
Thank you. All right, any other questions or comments?
Thank you so much for the opportunity to speak with you all this morning.
Thank you, Annette, so much. Appreciate it. So. All righty, so moving on to our next item will be public comments. Did we receive any from staff?
No, we did not.
Thank you, Joshua. Any public comments on non-agenda items? So raise your hand or just chime in. All right, seeing no public comments, we'll move on to item number 4, old business, fiscal year 2020 HUD CoC program renewal updates. This is probably Natalis.
All right, good morning, everyone. There's Natalis here, and then regarding the 2020 HUD CoC program, and down the memory lane, and on January 29th, and HUD announced that there is an auto renewal, for all the projects that are eligible for renewal. So, and then currently we are still going through the contractual arrangements with HUD, and then we will continue to do that, and then once we have executed the grant agreement with HUD, and then we will be moving forward with the subrecipient agreements with the agencies.
Any questions on that? All right, Natalis, if you just want to move into the next item, number B on the 2021 HUD CO program.
Yeah, so, and then when it comes to the 2021, HUD CoC program competition, and so registration was submitted back in February, and it was due in March. So we submitted early, and we just completed the review process on May the 10th. And then we currently have the CoC ad hoc work group that has been working with our consultant to review and recommend the revised project evaluation and ranking tool, policy procedures, and then once we have a recommendation, and then we will be presenting it in the upcoming CoC meeting, and then so historically the NOFA, the notification of funding availability, typically has been around July to September, but then it can happen anytime. So I know that HUD usually is aiming at earliest sometime in June, and then so we are staying tuned, and then so that is historical, but then nobody really knows when it comes out.
Any questions for Natalis? All right, seeing none, thanks, Natalis. We'll move to item number C, the 2021 homeless shelter point in time count. Laura.
Yes, good afternoon to everybody. Just wanted to provide a brief update regarding the timeline for the point in time count. We have passed our submission deadline for HUD. It was submitted successfully on time, thanks to our HMIS team and all of the HMIS agencies that supported our effort to collect all the data. We have also submitted this data to our UCR team that we continue to work with so they can begin data analysis. And we just wanted to share a little bit about kind of the release of the data as we move forward. We have some dates on there. They're, you know, tentative dates, but June is going to be very busy in terms of making sure that we share the results with our community partners, including Board of Supervisors, CoC Board of Governance, as well as the CoC membership. We will continue to work with UCR to create and finalize the 2021 dashboards, including all of the shelter data. In past years, we did give it some time for cities to review the data, and if they had any questions or concerns about the results, they would be able to have a meeting with us to discuss that. Because this is shelter data, we don't see that that might be something that we will need to do. However, once again, we will share the data, preliminary data, with cities as well. And once again, just do a quick check-in with our district supervisors so that they can take a look at this information and preview the results and identify any corrections that need to be made. And then finally, we will present to the Board of Supervisors the data, the final data. We will create the dashboards as well as highlights and summary of the results along with the UCR team. And so that's something that we're going to be continuing to work with our work group that we have been meeting with. It's been great to get their feedback. If you are interested in joining that work group, please let me know. I will, once I have the next meeting for the work group set up, I will share it with all of the CoCs so that if anyone wants to come on board and be more involved in looking at the results, they can do so. Next slide. We will also work on setting the date for our community debrief, which is something that we always do after the point in time count results are released. We will do some press releases as well as post all of the results as well as the dashboard link to the website. And then finally, we will create the 2021 sheltered point in time count data report. So that's once again something that we've done in the past, and we will continue to do that mainly in the month of June. In terms of a community debrief, that is kind of the last piece of what we do because it comes along with a 2022 point in time count kickoff event where we start our planning efforts for the upcoming point in time count, which HUD is definitely saying that is going to be a requirement for all of the CoCs. So we're looking forward to working with all of you in the coming months. If there aren't any questions, I see Tanya's hand is raised. You might want to have a comment about that.
Just a comment. That's scary. So just a comment. I wanted to thank Leonard Jarman, and I know there were other members within the Continuum of Care that met with us and UCR in the development of the dashboards. We were really focused on not only making sure that, right, we provide more data that really focuses on highlighting the subpopulations that have been a critical focal point for each of you, the Continuum of Care. So we're looking at adding, as an example, in addition to the senior dashboards, a youth centered dashboard that we can't wait to share. So in addition to the data that I mentioned, we want to make sure we created a fresh look. And I know Laura already mentioned this, but already starting to get lots of questions about next year's point in time count. Know that we are eager and excited to take our existing methodology and do more has been the common theme. I think one additional area of focus, in addition to counting people, has really been on making sure that we can help facilitate housing and other resource placements on the day of the count. So we're thinking bigger, but we know that we can do it with your help. So please continue to reach out to us, email us, let us know if you have any ideas. But as soon as we get those planning meetings together, know that we will be sending you invites. Thank you.
Yeah, the work group will begin to meet weekly as we kind of get towards the end of the development of the dashboard. So we need someone that has that time commitment and also that kind of a data analysis mind, because we need those skills at the table. I know also Greg has joined some of our work group meetings and has provided great input and feedback. So you are all welcome to attend. The dashboards are still being developed. There's still a lot of work to do. So please join us if you're interested. I will send out the meeting information this week. Thank you, everybody.
Great presentation. Thank you, Laura. And just a shout out to HMIS staff to basically on-time submittal with everything you were doing to convert HMIS to the new system. So great job. Appreciate that.
Yeah.
All right. We handled new business under 5, so we'll move to number 6, standing items, Board of Governance update. I know Tammy's on the call too if she's got anything to chime in, but basically just wanted to go over the status of the Board of Governance and Continuum of Care strategic planning process. LaSar Development reached out and asked for participation in a survey that was completed by May 14th. Those questions surrounded like existing countywide collaboration efforts, cross-sector integration, homeless tracking, strengths and challenges around existing systems, et cetera. LaSar is about done analyzing the HMIS data that's submitted to HUD. They are also currently interviewing stakeholders that consist of individuals in leadership of the CoC, service providers, city, county government officials, healthcare, and especially persons with lived experience, which we really wanted to highlight this year. Those interviews are still in process, but really, really great participation. So thanks to those of you who've participated in that process. We are expecting a final report in June that will be presented to the Board of Governance at the June 17th meeting. And then with action steps on how we move forward with strategic planning and development of an action plan. Again, long time coming and working on this, and of course COVID put a huge wrench in it, but really excited about the path we're moving forward on this. So any questions or comments from that? Tammy, I don't know if you have anything to add for Board of Governance, but more than welcome if you do.
Just a great update, Greg, and I'm just excited about this next step with our strategic plan and encourage people to provide that information to LaSar if they're called upon, and I'm just excited about the future. So thank you very much.
Great, thank you, Tammy. All right, we'll move on to item B, COVID-19 vaccination and coordination effort. Joshua.
All right, thanks, Greg. So at the last meeting, well, we presented this new initiative on behalf of the CoC in attempts to connect sheltered or unsheltered homeless individuals with vaccines, COVID-19 vaccines. And we've made some good progress since then. So I'd presented a past event that we had at Martha's Village and Kitchen, and there's some stats there. I won't go over them again. We went over them the last time, but we did have an event last Thursday at St. George's Church in San Jacinto. There were 6 individuals vaccinated with the Johnson & Johnson vaccine. 1 individual was unsheltered, experiencing homelessness. There were, so for some context, this was a resource fair of sorts, right? So several agencies, both with the county and outside of the county, had representatives at the site to provide resources for homeless individuals or individuals experiencing homelessness, from the Housing Authority, Behavioral Health Department, and Department of Animal Services. So thank you everyone who participated. And if we do have anyone from Public Health or EMD on the call, thank you so much for your coordination there. We do have an upcoming event tomorrow. So Hafsa was so kind enough to work with us and eager to host an event at the City of Riverside Access Center tomorrow from 8 a.m. to 4 p.m., given the hours of the Access Center. They will be available for sheltered and unsheltered individuals. And we'll have outreach teams from Path of Life Ministries, City of Riverside, and CityNet, and any other outreach groups that Hafsa or myself have reached out to. And if you have any questions about this event tomorrow, please email either myself or Hafsa directly, or if you email me, I'll do per end.
Josh, are you doing the J&J vaccine tomorrow?
That is correct. Yes. Our goal was to use the Johnson & Johnson vaccine just for the sake of ease, not having to worry about bringing in individuals for a second appointment or having them miss a second appointment. It's just a one and done.
Great.
So if you do have any questions or want to schedule an event, please email me directly. I included my email in the slide, and this is my office number as well. So please feel free to reach out. And do we have any immediate questions?
Yeah, I think Hafsa has a question or comment.
All right.
Hafsa?
I just raised my hand real quick to put it on the record, gratitude from the City of Riverside to Josh and the team. Thank you again. And I just also want to give a shout out to Leonard for helping us make sure we navigate it to all of our partners. So thank you again, Josh. Our city council and our mayor are very grateful. Thank you.
Yeah, great work. You know, I have a question either for CVRM or Martha's, because I know, you're our other major shelters in the county that I know you've been vaccinating. And I'm just wondering if there's any hesitancy or how you're seeing the willingness of our homeless residents to get the vaccine. Either Linda or Kim. Or you don't have to tell me.
In the meantime, if they're, getting to unmuting their microphones, Greg, when I was at the event last Thursday, there were other individuals experiencing homelessness or at risk.
This is Linda.
Oh, hey, Linda, go ahead.
Hi. I would say it's actually the response or the willingness is better than I thought. But Martha's has a circumstance where we actually have an RN and LVN on site.
Right.
So we're able to continuously give updates and meet with clients when they have questions. But even staff, I expected more hesitancy than we've had, actually. Yeah. And making it more available. And of course, if we're doing intakes, at the time of intake, we go through it, and we're willing to take them for testing and vaccine in that moment because everything's now so available.
All right. Good. It's great news.
Uh-huh.
Thanks, Linda. Josh, did you have anything further? I think Linda kind of hit it on the head. But, so.
I think so as well. I think what's really helpful is having somebody there who can educate about the vaccine itself. I think sometimes there's initial hesitancy, but once explained or given some education or some context, then it seems to be a little more successful as far as receptiveness to the vaccine.
Yeah, and I think Linda makes a great point. This is not for our homeless residents, but everybody overall in the county is the availability is so much better than what it used to be. So access is much easier. So great work, Josh. Thank you to you and your team. Appreciate that. Moving on to the CoC lead agency update. Tanya, please.
All right. Good morning, everyone. Happy to jump in here. Josh, if you will kindly take me to the next slide. So a few updates for you. I think it's really important to introduce you to two new staff members. If you've attended any of our committee meetings, then you have likely already met them, at least virtually or perhaps through an email. But we're excited to welcome Terrell Sales, who is our new Emergency Food and Shelter Program, or EFSP as you know it, specialist, and will be working under and very closely with Rashana Walker as part of our programs team. Welcome, Terrell. He is here. And we also wanted to introduce Monique Guerra, who is our new youth specialist coordinator. She is not new to the continuum of care. Many of you may recognize her. She formerly held the Board of Governance seat for as a youth representative, and has lots of experience working with United Way, City of Riverside, and I think we're most grateful, right, because she is definitely one with lived experience. And I can tell you the last few weeks, like Terrell, both of them have really been critical in helping us enhance a lot of our conversations around youth homelessness, but also poverty. So welcome, Terrell, welcome, Monique. We also wanted to announce that we are expanding. You've heard us talk a lot about new funding becoming available. And so we're looking at adding some additional recruitments that will be temporarily. So we're looking at 6 to 12 month assignments to help us advance our emergency solutions grant, coronavirus round 1, round 2 funding. So we have 8 recruitments that are currently in the pipeline. If you know of anyone who would be interested in joining our Continuum of Care team, please let us know. We love referrals. And while we definitely recognize the importance of having individuals who have formerly homeless experience, as you know, we have a large planning team, research team. So also looking for folks who have experience in data management, configuration, those types of areas. We also just wanted to remind you that we are accepting nominations for Monique's formerly homeless youth representative seat. We did send out an email, and nominations are due June 2nd. So help us fill that seat. Looking to Jim, Cordell, Rainbow, right? A lot of our strong youth advocates who I know have shared with me on the side that they have some folks in mind. Also, other big news is we wanted to share that we are pretty close to finalizing our ESG coronavirus round 2 funding recommendations. This is the large $32 million programs that you've heard us talk quite a bit about, and we are targeting the Board of Supervisors meeting on June 15th to finalize those recommendations. We are looking at scheduling individual meetings with each of our supervisor district offices before June 15th. But what you should know about that from feedback we received from you at the last Board of Governance meeting, we are looking at making major investments in creating new beds through rapid rehousing, expanding our access to emergency shelter, and probably one of the things I'm most excited about is implementing coordinated street outreach teams in each supervisory district. So we'll have more. Obviously, I can't give you a preview of those funding recommendations until they go to that board. It will be a public document, but know that we will race back after that meeting to give you a full overview of what that is going to look like. The next 3 things I'll talk about, I have slides for, so I'll go ahead and just stop there just to see if anybody has any questions. All right, and that's okay. You can hold on to your questions and come at me later.
Actually, Tom,
sure.
Is Terrell related to Sunday?
He is related to Sunday, yes. Terrell is actually Sunday sales. Many of you know our Sunday. She is with Supervisor Washington's office, and Terrell is actually her son.
Good. So he's got a lot of knowledge from a really great mom. So thanks.
He does. He just graduated from UC Davis. And as you can imagine, right, formerly from Corona, is returning back to serve the community. Like many of us, has a background in social behavioral sciences. He got his bachelor's in sociology. And he's also a football star. If you YouTube him or Google him, you'll see a bunch of cool videos with him in action. So I encourage you to do that.
Great. And it was sad to lose Monique from the Board of Governance, but definitely glad she's on the team. So
Yes. Yeah.
Any other questions for Tanya? All right, you can go ahead, Tanya.
All right, let's jump in. HUD released the Youth Homelessness Demonstration Program. What we need to know is there's $145 million available through June 1st, 2022. Our HUD, our U.S. Department of Housing and Urban Development, is looking at awarding 50 communities and potentially a minimum award of $1 million per community. Just based on previous awards that have been made, we have seen communities receive up to $3 million. So Riverside County is very interested in, shooting for the stars, submitting a strong application and getting as much as we can. The grant application is due July 27th. The good thing is that it's not a new template. We know what we're working with, and we've made some great investments or taken some great steps in the last few months, like hiring a youth specialist, but keeping our youth advisory council active, as well as having good conversations on implementing, as an example, at the last HMIS CES Oversight Committee, implementing a youth BI SPDAT. I included here just a breakdown of the scoring rubric in case you're like me and just very curious on what that looks like. And here is my pitch to encourage each of you to participate in our Youth Advisory Council meeting tomorrow. It will be held virtually via Teams from 10 to 12. If you are interested in helping us submit a strong application, perhaps you'd like to join the planning team, or you have an innovative project that should be included, please do join us. If you need the link, feel free to email us at coc@rivco.org or let us know in the chat box and we'll follow up with you after this meeting. Just going to stop there, see if there's any questions.
Any questions on that, Tanya? All right.
All right. And the last thing, I know there's a lot of information here, but we have started receiving inquiries about the emergency housing vouchers. So I wanted to make sure that as we work towards implementation, that we receive feedback from each of you. So my hope is that after my brief overview that we can allow some time, folks feel comfortable to unmute themselves and provide feedback. But essentially, our Riverside County Housing Authority is receiving 347 emergency housing vouchers that are being prioritized for individuals who are at risk of homelessness, experiencing homelessness, and other vulnerable populations. We need to finalize an MOU by a July target date. So I want to let you know, very proud of our Continuum of Care team who did not delay and last Thursday prepared a very first draft of that MOU to the Housing Authority. Just so you guys know, I don't want you guys to worry about, we did not, the detail in the MOU was really about, making sure that we create a referral path so that referrals come through our coordinated entry system, and that it basically designates a liaison on our team and on the Housing Authority side that would help facilitate communications. And again, we want to make sure that we get that MOU executed as soon as possible. So, we put ourselves in a good place to receive those vouchers. Some recommendations for use, and this is where, again, just really want to get your ideas. We've had a lot of conversations about creating more permanent supportive housing beds. These are beds for our most vulnerable, chronically homeless individuals on our by name list. And we see an opportunity by launching a Moving On initiative that would essentially graduate about 89 households who have been utilizing a HUD CoC PSH bed for over 5 years. So, right, it makes sense. Let's graduate them over. Let's open up those 89 beds for people that are currently on our Home Connect list. The other recommendation, which again, this is largely inspired by each of you, our rapid rehousing providers. We know we have a large systems challenge with rapid rehousing because over the last 12 months, access to employment has been very, very difficult. So one of the strategies we'd like to use is to essentially transition people from existing rapid rehousing beds over to a Section 8 voucher. Of course, we would still encourage providers to continue using progressive case management. So if you do have clients who have successfully linked to workforce and they no longer need rental assistance, right, then we may not transition them. But we recognize that a lot of families are rent burdened, and just hearing from Path of Life and Lighthouse and other agencies, we know that there's a systems challenge with rapid rehousing and getting landlords to accept a temporary voucher in this climate. The other thought is, and I can't take any credit for this one, Lindsay Sisti from our team came up with the idea of let's clear up the 162 people that are currently on our Home Connect by name list who have scored for rapid rehousing and again don't require those intensive supportive services that would support ends to youth, family, and senior homelessness, which have been our focal point. So I included a link there with more information, but with that, I'll go ahead and stop and get your thoughts, suggestions, and feedback.
Thank you, Tanya. Any questions, thoughts, or feedback? Really detailed report, Tanya. Thank you.
All right, feel free to email me if you guys have any feedback. We'll know that this will probably be on the agenda for months to come as we work with providers to make this happen. Thank you, guys.
Tanya, that's Karen. I just wanted to say thank you for doing such a great job. I think you've tried to be very thoughtful and looking at the multifaceted aspects of the needs and the continuum and to cover some very important points. So looks like you guys spent a lot of time and really thought this through in terms of the different strategies that are needed. So good job.
Thank you, Karen. But again, I really cannot take any credit. These are conversations that happen here at this meeting. I think I quoted several folks, right? Several agencies. So thank you for inspiring the idea. And I think what I would say, right, is just kind of keeping in mind my sort of theme for the year is we're in this together. And I know we're all, right, we share a passion in ending homelessness. So if there are any other specific strategies, ideas that you guys have, please don't hesitate to send those our way. Thank you.
Great, thank you, Tanya. There are some comments too about the liking the Moving On initiative in the chat box, Tanya. So, all right, thank you. We will move on to item number D, our CES lead update. Marcus, my friend.
Thank you, Mr. Chair, Madam Vice Chair, members of the committee. We appreciate the time always to update you. If we could go to the next slide, please. We'll show you standard information that we present in the staff report. Oops, we may not have it in there. In the staff report as one of the attachments, we list the numbers that we always report out on. There are not significant updates there to share with you, so I think in the sake of time, I'll just refer you to the attachments that are in the Google Drive. As you might remember, we list how many outstanding referrals do we have, and then we do a bit of breakdown on that. Those referrals based on score, those referrals based on age group, and then we do the same with the number of people that are on the by name list. We break it down by score, break it down by geographic region, break it down by age group. I think the more pertinent updates that I would want to share with you really are about, yeah, this is the slide. Thank you, appreciate it. So again, this is here for your review, but there's no major changes in trends here. And it's certainly not numbers that I'm going to read to you row by row. But what I will share with you, if I'm able to share my screen, hopefully Josh can let me do that, are updates about our work on the HMIS and CES integration. That's work that we've been doing with the support of the HMIS team, certainly. And so I know Gordon has more information that he'll share, but I just wanted to talk a little bit about really the CES specific workflow portion of that. Hopefully you're able to see my screen. Yes?
Yes, Marcus.
Yes, Marcus. Okay, thank you. So as we move into Clarity, a couple things that we wanted to highlight as updates for this group. For those of you that were familiar with Client Track, I think the Clarity user interface is better in that coordinated entry is less of a sort of a separate cordoned off activity. And so it's more of a seamless workflow. But a couple key things in terms of decision points. We anticipate having all users, anyone who has HMIS access would have access to the coordinated entry portions of that workflow. I think that's going to be simpler, given that we've got a lot of variety in terms of agencies and the way that agencies organize their work. For instance, agencies might have field staff who are performing the VI-SPDAT assessments, but then different data entry people that are entering them. So we decided that it's easier to allow everybody who has access to HMIS to have access to CES. And then on our end, sort of on the back end, from the lead agency perspective, if we have staff who we identify that are conducting VI-SPDAT assessments that haven't been to a training, then we can follow up and make sure that we get people trained and support agencies, as opposed to trying to allow access on a user by user basis. I think this will be easier to manage and easier to use for our agencies. In terms of client intake enrollment, we have some decisions there to do a full client intake enrollment or a brief intake and enrollment. The advantage of brief, right, is we always want to do less if we can do less, but multiple of the data points that are included in the full client intake enrollment are things that are required for our various state funding sources. So while it might ask a few questions that HUD itself doesn't mandate, given that we're going to need the data for state of California and other compliance purposes, I really feel like that's the way that we want to go. In terms of our data migration update, we will be moving all the active clients that were active in the CES workflow and Client Track onto the CES workflow within Clarity. And then likewise taking all those clients that were on our by name list here that we kept up to date here within the lead agency and moving those into the new CES workflow and Clarity so that we'll have one integrated list. And then consistent with previous policy, if there's no contact with the client recorded after 90 days, that client would be removed from the by name list. So essentially, that's a benefit to our agencies again, so that when you're a housing agency and you have a vacancy, that we ensure we're referring a client to that's really able to be found and is ready to be served, as opposed to having a list that can be stagnant. Couple more things. As agencies start using HMIS more, and Gordon, again, will have more details about dates, we do request your feedback about the data collection fields. One of the benefits of Clarity is that it allows us greater customization than Client Track did. And so between the standard client enrollment form and then the VI-SPDAT, we think that most of the data we would need would be captured there. But if you as an agency are recognizing other data points that you need that aren't getting collected, then please give that input to, Gordon and Sally and Mary and the HMIS support team, but you can also give it to us if it's specifically CES related. We're working again with HMIS support team to collect more data about veterans. And one point I would mention is that the client enrollment does ask for, is the client a veteran? Yes, no. And then it asks follow-up questions about character of discharge. And so we're working to train staff who are entering or who will be entering to make that reminder to them to note the character of people's discharge. That's a research question that's been asked within our CoC, and we want to make sure that we have that data and then also that we're able to get resources for folks of all different discharge status. And then last but not least, we will be having refresher training about VI SPDAT. As most of you know, at the HMIS and CES committee last week, the vote was to move forward with using VI SPDAT 3.0, as well as to begin using the TAE VI SPDAT within our continuum of care. The methodology of how you administer those assessments is unchanged. And the assessments themselves it's tweaks, minor changes from version 2.0. So if you're already trained, we're not recommending that you need to retrain if you don't want to. But we want to offer a training so that people who either need training for the first time, or perhaps it's been a while since you've been to a training and you want to see what the changes are to 3.0, that we offer a refresher training. So we'll be sending information out about that shortly. And two more things I would add. Gordon will talk to you about dates for full HMIS access. We'll be trying to send out a coordinated email with him and the CoC team with the new VI SPDAT PDF packages so that your staff will have the VI SPDAT 3.0 itself, as well as the supplemental questions all in one PDF, and that we can get that out in a coordinated fashion. So expect that from us. And then I just wanted to share that I know times of transition always can raise anxieties, but in the last 2 months, essentially, since we stopped having data entry into Client Track, we here at CES have received over 100 SPDATs from 44 different assessors. So the flow of clients in has not slowed down. And likewise, the flow of us making referrals out to agencies that need referrals has not slowed down. So I just wanted to reassure folks that even though our HMIS access has been limited, the assessing of clients has not slowed down. That's very much consistent with what we would normally see in a 2-month period, and our ability to make referrals hasn't slowed down. So I know that's a concern that I wanted to speak to. If there's any questions, I'm happy to answer any.
Thank you, Marcus. Any questions? Hafsa.
Hey, Marcus, thank you so much for all that information. I may have missed something because I haven't been able to sit in on a lot of the, pre-meetings, but have a question regarding the inactive clients. I understand perhaps the inactive clients could be individuals who have self-resolved, or it could be quite the antithesis. It could be the individuals who may not even be engageable. So I guess my question is, do we have a trend of the inactive clients? I mean, do we have sort of a deep analysis as to what makes them inactive and how potentially we could work towards a process in helping create activity? And the reason I ask is because our outreach workers, we're really trying to hone in on doing additional best practices, really going above and beyond. So if you could shed light on some of the inactive trends, that could be helpful.
Okay, I think to some degree, I'll have to get back to you on that when you talk about trends and specific data. I can say that typically when clients are moved to an inactive list, we're using the maybe to back up one step. When we say that the client is inactive, we base that based on whether there's recorded activity on the part of the navigator, right? The assessor, the case manager. So sometimes that reason can be that the client is no longer locatable, and so that assessor, case manager, navigator has no activity to record. But obviously the opposite possibility is also true. If that assessor, navigator, case manager might be providing services to that client but not documenting it, then that also could be problematic, which is why we send out those regular updates of all the clients and say, hey, here's people that we don't see activity on. Dear assessor, dear navigator, dear case manager, can you confirm whether you're still working with this client or not? This is consistent with HUD guidance, but I hear your point about what do we know about who becomes inactive. That's an area for further study. I can agree.
Thank you so much, Marcus. I'm just
Sure.
trying to figure out a way we could, reach, do our due diligence from an outreach perspective. Thank you.
Yeah, absolutely. I think the good news is, let's say our hardest to serve client, the client who's least receptive to assistance or services, that in and of itself doesn't remotely make that person inactive. They might be very active. Their case manager's out there talking to them every day. So as long as there's activity, that person doesn't move onto an inactive list simply because they're, hard to reach. It's really more trying to identify people who are no longer reachable, physically, like we don't know how to find them. To your point, they've self-resolved, they've moved to another community. Because as a housing agency, when you're asking for a referral, the last thing you want is a name referred to you, oh, here's Karen, we're sending her over to you, but Karen can't be reached. No one knows where Karen is. She doesn't answer her phone, right? That doesn't do anybody any
Karen
good.
can be reached.
We know Karen always answers her phone. Any other questions that I could answer?
Any further questions for Marcus? All right, not seeing any. Thank you, Marcus. Appreciate that.
Absolutely.
Moving on to the HMIS lead update. Gordon.
Hey, Greg. Thank you for having me. Good morning, everybody. My name is Gordon Kwan. I'm the HMIS lead, and I will be giving you an update on the HMIS Clarity Human Sources. And I will start by following up with what Marcus just talked about, which is our collaborative process on setting up and configuring the coordinated entry system. So here on the slide is just a preview of some of the key critical entries, in our timeline and our process of creating the coordinated entry system. And we've been collaborating very closely with our HS Behavioral Health, particularly the CES team, Marcus, Chris, and Morel. Shout out to them. Thank you for their help and their guidance. And we structured and configured CES to ensure that the accessibility and the features are able to facilitate and suit the needs, of our agencies. And as you know, the individuals who may have attended the meeting on May 20th, the CS HMIS Council have approved the VI SPDAT 3.0s. And with that said, the HMIS team and CS work together to incorporate that into the CES system that's in Clarity. And we've had consultations with Focus as well. And one of the reasons, for that is because Clarity allows us to, in other words, slice and dice the creation and setup of the CS in a variety of different ways, either using single queues, centralized systems, decentralized, systems. But we've been working with a CS to create a system that is similar as much as possible, matching what users are used to in client track, which is utilizing a centralized system and having individuals enroll their clients in a Home Connect program within CES and creating the SPDATs. And right now, based on all of our collaborative efforts and all our hands on deck, we are targeting a June 3rd date to have the VI SPDATs to be available for all active users in our active agencies. So at that point, regarding going back to what Marcus said, it will be all agencies. So not only users who have access to CES, but this time around, we chose a configuration where all agencies and active HMIS users will be able to create the SPDATs. Josh, if we can go on to the next slide. All right, and here, I just wanted to give you a preview of what you will be seeing in Clarity once the configuration is finalized. And like I said, there is a lot of, and Marcus mentioned earlier too, the customized settings. So we have Clarity, which has a lot of default templates, but we want to make sure that CES is configured and set up for Riverside County CoC. So here, when you go into assessments in Clarity, you will see the 3 types of assessments that have been approved in our previous CES and HMIS Council, which is the family VI SPDATs, the individual VI SPDATs, and also the TAE. And you'll have the ability to select from all 3 of those assessments. And in your client profile and dashboard, if you have completed any assessments, you'll be able to see them in the assessment history. I created a test assessment and took a screenshot, so you guys will be able to see that. All right, can move on. And here is a preview of the TAE that Marcus was referring to that was approved. As you can see, we have a variety of different data fields: assessment location, type, level. We have history, we have risks, and the list goes on, and it's a quite detailed, page. And if we do find that there are, particular fields that need to be captured, we can definitely work towards creating a additional fields, onto some of these assessments. And we can move on to the next assessment. Oh, Josh, I think you might have skipped a few. Yep, yeah. And this is another preview. That was the TAE, and this is the family VS for that, version 3. And as you can see, it is a similar in terms of the look and feel, in terms of the TAE, but obviously the content, will be different. All right, we can move forward. All right, so with the CS and Home Connect and VIS for that, information out of the way, I'm going to give a breakdown of some of our HMIS information here. So the number of participating HMIS agencies is sitting at 33, and number of participating active HMIS users is 209, and that's the number of individuals who have completed the Clarity General training. Now, for the HMIS users pending completion of training, that's actually not 251. It's actually, that's the number of individuals that have registered for the Clarity General training. The number of individuals who are pending the completion is actually 42. So that's the number of individuals who have taken the training, but have not completed it. So if you have anybody in your agency who started the training, we encourage you to complete that and let us know so that we can grant you access. Oh, okay. Oh, thank you, Josh. Appreciate that. So I want to talk a little bit about the services in Clarity. That was a conversation we had on one of our previous meetings as well, and we are very happy to let you know that the service configuration and setup have been completed for all of our active agencies. And what that means is you may have already received a notice from myself or Mary, Sally, and Salam, one of our HMI staff who've alerted you that your services have been configured and you're able to attach them to your clients. And because each of the services need to be configured individually for each of the agencies, as soon as we were done with one agency, we reached out to you immediately to let you know. So, and either yourself or if not yourself, one of your HMIS administrators may have received that notification as well. And regarding the legacy services, we've sent our custom migration services to BidFocus, and it is currently under review. And if they have any feedback from us that we need to make any modifications to our data, we'll do so. But if not, then we will continue with the migration process of our legacy custom service data. All right, and to just touch base on some of the other features in Clarity. So our agency users are able to run existing ad hoc reports, and I just wanted to bring that up because with this transition, some of you, and including myself and our team, have been used to the reports that are in Client Track, but Clarity has a different suite of reports. And some of them include program-based reports, administrative reports, data quality, and HUD, and those are all available in the reporting section of your dashboard. And again, we want to iterate that the VIS for that will be available to all active agency users, and we're shooting for a target date of June 3rd. All right, and that will conclude my presentation for the HMIS as well as the CS and VIS for that setups. Before I wrap up though, is there any questions that I can answer for anybody?
Thank you, Gordon. Any questions for Gordon?
All right, Greg, thank you for your time, and thank you everyone for your time.
Thank you, Gordon. Appreciate it. Thorough report. So, all right, moving on to item F is a housing resource update, and we're going to have a quick presentation from Vice Chair Karen on the Santa Ana River bottom encampment response.
Good morning, everybody. I'm super excited to give you all an update. The reason why I'm excited about this is because we, as a continuum, we have been talking about the need to strengthen sub-regional collaboration, knowing that a lot of cities share a common challenges related to the homeless neighbors that we're serving. And so we wanted to give you an exciting update on something that's happening in the western region of the county. And I wanted to start off by, first of all, acknowledging Supervisor Karen Spiegel. I think I saw her log on this morning, as well as Deborah Rose. You know, political will really helps to move the needle. And, you know, just a shout out to the supervisor who's really done a lot of heavy lifting to bring all of the cities together, along with county agencies and many other partners, which I will talk about. But I think many of you all know that there's a huge amount of our homeless neighbors that live in the Santa Ana River. And because there's a high concentration of folks that have been there for a very long time, many chronically homeless that have been on the streets for many years. And the fact that there are encampments, it has not only affects the quality of life for the homeless neighbors that are living there, but also an impact to wildlife habitat and even the surrounding community. I think you all know right now, as we speak, there is a fire that is burning in the Santa Ana River in Jurupa Valley. I think it's, as of this morning, about 90% contained, but it's 115 acres. So there are impacts to a lot of different facets of the community as a result of the fires. So I also wanted to give a shout out to the city of Riverside, who has for a long time been talking about the need to coordinate cities across the Santa Ana River. They've done a lot of heavy lifting through the years, and even recently worked to coordinate cities along the Santa Ana River. And then also to Heidi and her leadership, the Housing and Homeless Prevention and Workforce Services Department is really taking the lead to bring all of the stakeholders together. But Heidi is such a great leader and collaborator. She actually asked the city of Riverside and the city of Corona to co-lead this effort with her, and we've had a number of different meetings with stakeholders. So let me just jump into the first slide. This is just a 50,000 foot picture of what the goals are. So we want to make sure we can rehouse all the folks that are living in the encampment, and make sure that we have ways to avoid recidivism and look at long-term housing options, and then remove and mitigate the physical impacts of the encampments. And there's a lot of regulations that surround that, and I'll talk about that later. Look at cleaning up the habitat and restoring wildlife, and then to make sure, like I said, that we can prevent recurrence of homelessness in the encampments. And the reason why I say that to you all is in November in the city of Corona, we had a huge successful encampment cleanup. There were about 8 encampments with a lot of folks living in the Santa Ana River and the Prado Basin area. We worked with all the stakeholders, with U.S. Fish and Wildlife, the Army Corps of Engineers, other stakeholders, went through all the process of conducting outreach and trying to connect our homeless neighbors to resources. High barrier folks, service resistant, and a lot of folks said no to resources. We went through the whole encampment cleanup, and not long after that, a lot of the encampments were repopulated, and we had a big fire in December. So I say that to you knowing that folks experience challenges with the folks that are living in the Santa Ana River, because they have so many different needs. So let's go on to the next slide. For the Western region, this is just a snapshot of the partners that we are working with right now, the cities of Corona, Eastvale, Jurupa Valley, Riverside, and Norco. You can see the different county departments that are at the table: Animal Services, Behavioral and Public Health, Probation, Flood, of course, Heidi's team, Parks, Sheriff, Workforce Development, and more. And then just as an example, CityNet is common in the cities of Corona, Norco, and Riverside in terms of outreach and sheltering. And you can see there are a lot of other partners that are listed there. It's really a huge, multifaceted, big collaborative effort. And this is really unique in our history for the first time where all of these agencies have come together, and we want to develop a coordinated, integrated plan to address encampments down in the Santa Ana River. So moving on to the next slide. So what's been happening right now, we're in this phase of the plan, which is we've had multiple meetings with the stakeholders to talk about all of the issues, to talk about what it's going to take to commit from each of our agencies and the resources that will be required, developing mutual goals, objectives, and even the outreach plan, and then talking about how we're going to map all the encampment sites, looking at ways that we can integrate multidisciplinary services and make sure we have good communication lines because that's going to be important because it's such a huge project. Okay, Josh, next slide. Then from May to June, really kind of talking about just some of the things Marcus referenced about VI SPDAT. That is going to be critical in this particular project because we're going to need to develop a by name list. That's a big area, a geographic area to try to cover to get a good solid by name list and really look at engaging our neighbors down in the riverbed with the VI SPDAT process so we can get a snapshot of all of the different needs and then try to figure out ways to map those needs with resources, looking at the environmental conditions and hazards, and then really develop a high level report in terms of the demographics and the service needs. And then of course, make sure that we're not forgetting about COVID in terms of testing and vaccinations. So let's move on, Josh. How am I doing, everybody? Hopefully I'm not going too fast for you. Just keep your seatbelts buckled. I'm sorry I'm going through this so quickly. Okay, July through August. That's really the intense portion where there's mapping out the service needs, shelter options, long-term housing resources. And those of you that are in the trenches every day, you know about trying to help our chronically homeless neighbors, you know that the best practice is weekly case conferencing, getting all the stakeholders together to talk about each client individually, the different elements and dynamics of the case management and plan and housing navigation, because clearly one of the big barriers that we will face is open doors, so partnerships with landlords. So really going to have to be looking at like ramping up housing navigation. And then thinking about the plan to begin intensive resident engagement. So let's go to the next slide. So August through October, this is where we're gonna, at different sections along the Santa Ana River, look at ways that we can start with the low-hanging fruit, folks that might not have as many barriers, where there will be different resources that will be available that would be a good match for them. And even before you start doing that, really just trying to map out a very robust resource fair to try to talk to folks and get them linked to different types of shelter and services, you know, for seniors or folks living with HIV/AIDS or youth or other special needs residents. There are resources existing in different parts of the community that might be able to be a good quick match. And then engaging with our wonderful county behavioral health and looking at outpatient and inpatient recovery programs. A lot of these folks are living with severe chronic health issues. Those of us with experience in encampment response know that sometimes folks have immediate medical needs and need transport, and trying to address those issues quickly. And then again, really fine tuning the report on, for the folks that were like low hanging fruit in terms of immediate placements, what does that mean in terms of those that were sheltered or housed and those that are remaining? And again, not forgetting, we need to keep ramping up on landlord recruitment. So lots of housing navigation. Next slide. So November through March, this is where the rubber meets the road. And this is what I'm super excited about, knowing the experience that we had with our encampment cleanups in the city of Corona. And this is what makes this unique in our history, is because we have this highly collaborative partnership with all of the cities and the nonprofits and the county agencies. We can really drill down and focus in on intense outreach, housing navigation, and keeping up those weekly meetings and conference calls, continuing landlord recruitment, looking at ways to deploy therapists and substance abuse counselors in the field, just trying to bring those services where we can to the folks to engage them. Developing individual housing plans. This is nothing new to any of you, but we want to think of each person as an individual because we have a vision and a hope for the future for each of them, and just continuing to establish ways that we can fine-tune move out dates and connecting those folks to the necessary resources, and even dreaming dreams of a final date for closure for each of the plans and getting each of the housing plans and getting folks connected to resources. So as with any type of a plan like this, you have short-term, interim, and long-term goals. This is not as I love to quote Heidi, it's not a one and done type of a thing. It's going to require ongoing focus, but we want to start with shooting for the stars. So this is what might seem to some of you as an accelerated process or timeline given the size of the geographic region. But if you don't shoot for the stars, you can't grab the stars. So this is what we're going to start with and see how far we can get. Let's go to the next slide. So then the last quarter of 2021, what we hope to do is then transition to cleanup efforts. And I think if you aren't familiar with all of the regulations that are intertwined with encampment response cleanup, let me tell you that I lived through it. And for example, for us, I'll just use Corona as an example. We leased 1,500 acres in the Prado Basin from the Army Corps of Engineers. And before we could even think about encampment cleanup, you have to submit a comprehensive cleanup plan that has to be reviewed for us in Corona by the Army Corps of Engineers and then approved by the U.S. Fish and Wildlife. Because there are protected wildlife species, there's the least Bell's vireo, which is a sparrow that lives all along the Santa Ana River. It is protected. You cannot conduct any encampment cleanup efforts between March 15th through September 15th. So you have to develop these plans and get them approved, and you get certain types of permits. Some cities along the Santa Ana River have other stakeholders they have to work with, whether it's flood or water districts or parks, and there's JP, these joint powers authorities. So there's a lot of regulations to have to work through. So sometimes residents or businesses, they may not understand there are these big encampments with all of this trash and debris. Why isn't local government just going in and cleaning up? And I think as a continuum, we need to continue to educate the community that it's easier said than done because of all of the regulations. But if you can successfully get people housed, conduct a cleanup, you have a win-win, and I'm going to talk about that. So let's go to the next slide. So the win-win is really what our proposed outcomes and performance measures that we're shooting for, those stars that we're shooting for, which is we want successful placements in housing and referrals to services. So in this unique history of our county, with cities stepping up to the plate with resources, the county stepping up to the plate, coordinating with our nonprofits, looking at ways that we're going to do, quote, whatever it takes to get people housed. And then if we are successful in doing that, which I believe we will be, reduction of environmental impacts, fire. Like I said, there's a fire happening right now. And I know for us in Corona, others along the Santa Ana River have experienced this. Residents who live in high fire areas have had their fire insurance canceled or tripled in cost. And so this really helps with fire safety. We live in a high wind region, and we've seen other towns in California, right, completely burned down. So there's a lot of safety issues that we hope to be able to address and mitigate through this regional coordinated effort. And then a lot of people hike and trails. They ride their bikes, they ride their horses. Ways that we can improve trail accessibility and quality of life. And then, of course, removing the trash and debris, which is better for the wildlife as well as the residents. And then, a hope and a future for our our wonderful homeless neighbors that are living there that deserve a better quality of life. If they are connected to the right services and right housing, we will avoid recidivism. And I know I'm preaching to the choir. You all know these models, but just think how exciting if we are successful in doing this. We could use this as a model or a template to follow. It could become a state or national best practice. So we're like super excited about this. Let's go to the next slide. Is that my last slide? Oh, and then last but not least, so this is where we are. There's the 3 working groups. One is public safety that is going to look at fire risk enforcement and safety, and that's like fire departments, sheriff and police departments and park rangers. Then the homeless encampment response, that's the cities, county agencies, and nonprofits that are involved in client resources and coordination. And then the third is the facilities and habitat, so parks, Army Corps of Engineers, flood control, and really looking at trail maintenance, recreation, habitat, fencing, signage. And so we've had a few different meetings with all of the groups together. Now we're starting the process of scheduling, coordinating the subgroups. And so I'm super excited about this. I want to say again, thanks to all of the folks that are involved in this, and be happy to answer any questions from anybody.
Great, thank you, Karen. Great presentation. So I think it's really elevating some of the great work our county staff's already done in the past on some encampments. So this is just taking it to a great new level. So Hafsa.
Thanks, Greg. So Karen, I don't have a question. You asked me to jump on this and help support the presentation. So that's what I'm doing. I want to say thank you for reviewing this. And I see Supervisor Spiegel's hands up as well. So first of all, I do also want to thank Supervisor Spiegel and the 2nd District convenings. That's very important. I just want to take a moment and give a timeline of the efforts that have been involved prior to this. So back in Thanksgiving weekend, we had with the City of Riverside, a Budget Engagement Commission meeting, and I really want to thank Councilmember Edwards from the City of Riverside, who's been really pioneering a lot of the efforts as well, directly with the Santa Ana River bottom. It hits Ward 1, and we received a lot of tragic narratives of there's fires in the neighborhood, there's people who are being hurt. So Councilmember Edwards with the City of Riverside has really pushed to garner support regarding this. And then in December, we actually took it to City Council. We took a $1.4 million plan to address this issue. Unfortunately, you might have seen it at the press enterprise. It was, there was an article done about it. It was not approved. So that really speaks to the regional work around this and how important that is. So then that leads to January, where Supervisor Spiegel took it upon herself, and Debbie Rose. And I really want to thank you again for having those convenings. We were even able to hear from Assemblymember Cervantes about the importance of this, given that there's natural state land and just jurisdictional boundaries around this, where it includes county and different cities, and as Karen mentioned, fish and wildlife. And then most recently, just this past Monday, I invited both Heidi and Karen to present with me at our Homeless and Housing Committee to provide our council committee the information. And I put the link in the chat box so you could look at the staff report. But all of this to say is that the timeline took this much because it really is a regional effort. It needs to be a regional effort. And I'm so inspired by the comments on here from Susan to Greg to Casey and even Margaret. I mean, I see everyone saying this is wonderful. We need the resources and we need the coming together to make this happen. So as you want to be able to participate, I'm thinking, what kind of resources can we get from family services? What kind of resources can we get from other, entities? So again, I just really want to thank also Heidi and her team. Heidi, I know you did a lot of heavy lifting convening, folks, and we are looking sort of at a triple bottom approach with number 1, safety convening, public safety, number 2, homeless and housing convening, and number 3, general habitat. So once again, I just want to say thank you, Karen. It's good that you presented sort of from the CoC, and then county obviously is a huge stakeholder, and of course, big 13 city, the City of Riverside
Riverside, I just want to take one more moment to put on the record that all of these entities, the CoC collectively, the county, and the city of Riverside, we are recipients of the Homeless Housing Assistance Prevention dollars, and the HAP fund is from the state. And one of the important things that was required per that grant is regional coordination, as well as mandated working together. And so I just really want to say thank you to Tanya, because when we submitted our HAP grant, we did go ahead and indicate that we would work with our CoC and our county for this regional collaborative effort at the Santa River bottom. So when we talk about the best practices, we really want to wow the state. Wow, the CoC, the county, and the city came together to go ahead and have this presentation. Thank you.
Thank you, Hafsa. Supervisor Spiegel, my job as chair is a lot easier than yours yesterday, so.
We did fine. I just really wanted to, take what Hafsa said and the thank yous. I know that you can never say enough thank yous to volunteers, but I think we need to focus on another element that this is all about for my intention, and that is breaking down silos between cities. There are none, and I'm seeing how the blending between, Corona and Riverside, and now Norco, and you see the fire at Hoover Valley just had, it blends, and the silos are slowly going away, particularly on the homeless issue. To see all of you working together is really what is very rewarding. And that's the reason for convening the homeless solution within District 2. And I see the just such growth and positivity. And I see how working together has really made it a step further. And if we can just kind of spread that working together has such value, and taking, Karen and Hafsa's knowledge, expertise, experience, and sharing that among the other cities, and look what's happening. And I just see so much potential, and I'm really excited that you two are such leaders in this for my district, and of course beyond that for the county. And if people can see what's happening and how working together really works to break down those silos, and we can accomplish so much more. So thank you.
Thank you, Supervisor. Great point. As everyone knows, homelessness doesn't know city boundaries, and it's transient. So it's good to see that collaboration on the other side of the county. Any other questions or comments? Oh, great. Well, thank you, Karen. Appreciate that so much. I just wanted to just one little update on the first round of California Debt Limit Allocation Committee for credits for affordable housing. The county had 4 projects that were successful. That's going to be 387 units, most of those breaking ground in October of this year. And all of those include some form of either permanent supportive housing or project-based vouchers. And just so you all know, too, is that under construction right now in the county is 749 units of housing. Again, all of those with some element of project-based vouchers, VASH vouchers, or permanent supportive housing. So by hopefully November 1, we'll have over 1,000 units in production, which is unheard of recently for affordable housing. And again, kudos to Heidi's team, especially Mike Walsh, for his continued efforts on increasing the supply of affordable housing, because we know that helps with our throughput on all the great work that you all do on this call. Moving now to consent items, excuse me. These are all in your packet with the CoC staff report. Again, thanks staff for a great report. And then the committee reports specifically from HMIS CES. We did have a request for a letter of support and recommendation that was for Help for Futures Leaders. So Karen and I did sign on to that. And then the annual performance report for the City of Riverside's permanent supportive housing for the disabled chronically homeless. And if there's any call for agenda items, please submit those to the CoC at rivco.org. I would like to ask staff if we could get an updated report on the progress of spend downs. It doesn't seem like we've had one of those in a while, at least for the CoC. So if you could make note of that. And then finally on number 9 is announcements. We have the multidisciplinary approaches to ending homelessness. That's going to be on June 24th from 2 to 3, and that's breaking down the re-entry barriers. And I know the staff will send out a link to that. And then just a reminder too, the United Lift 2021 Emergency Rental Assistance Program is in full swing across the county. This has been a highly successful program. We believe that we're probably #1 per capita in the state on distribution of rental assistance. We're confirming that, but we believe we're at that. Also, additionally, there was a public comment yesterday at the Board of Supervisors meeting from, I believe, Metropolitan Water District, one of the water agencies, I'm sorry, I forget, about utility assistance and asking for ARP money to go with that. We are offering utility assistance in that United Lift program now. So if you know people that are in need, please have them apply. With that, staff, any further items? Hafsa, please.
Thank you. Just a lot of things percolating today. I just really wanted to say really quickly, thank you. If Supervisor Spiegel is still on the call, I want to thank the Board of Supervisors in the county for yesterday's Board of Supervisors meeting and opting into the Laura's Law. I want to thank, Marcus Cannon, Ryan Miller, and Dr. Chang, and all of the county leads that work on mental health services and behavioral health services. Is so important. We all know that not all homeless individuals have mental health, but we do know that there, vice versa, there are individuals experiencing homelessness that do have mental health. And so this tool in the toolbox is really going to be able to help with assisted outpatient treatment for the most vulnerable individuals, especially as it relates to the city of Riverside, where we see quite a few in our downtown area, and the support is always needed. So I just want to say thank you again to the Board of Supervisors for unanimously approving that. And then also at some point, we should discuss the $12 billion plan to confront homelessness crisis head on as a CoC that the governor announced recently. I know that there's probably going to be future agenda items, but I just wanted to put that on our radar and how we will, potentially strategize as a CoC. Thank you.
Yeah, it's a great point, especially on Laura's Law. Thank you, because I've been working with Dr. Chang on that for a while now. But additionally, on the 12.2, I think, Hafsa, what we're doing in my conversations with staff is waiting for the final budget approval, which should be next week. Or week after next, I'm sorry, because if there's any additions or alterations to what the buckets are, and then we can have that discussion. I agree with you about strategizing how we access as much of that resource as we can. So, all right, with nothing else, thank you all again. What wonderful attendance again today, over 80 people on the call. And again, if you've got any questions for staff, coc@rivco.org. And again, once again, my gratitude, not only to Karen, my vice chair, but again to staff. You guys are doing an absolutely amazing job. So thank you all and have a great day.